Well, hi, everyone. I'm Debbie Hatmaker, the American Nurses Association Chief Nursing Officer. And while I can't see all of you in our virtual setting, I feel your warm presence. You've been working alongside all of us at the ANA Enterprise during one of the most turbulent times in history. What a year to be a nurse. This year, we're celebrating ANA's 125th anniversary and the 30th anniversary of ANCC. During my time as an ANA member, board member, and now staff, I've watched this organization evolve and grow. In my own nursing career, I feel like I've come full circle. I started as a public health nurse running vaccination clinics and focusing on community health. And now 4 decades later, I find myself volunteering at a COVID-19 vaccination clinic. The experience of nursing is ever-changing, but always familiar. While President Grant focused on the strong, relevant work of ANA today, I'd like to take a few minutes to look back at ANA's history and view how we've arrived at this historic time. The ANA Enterprise story is the evolution of nursing in this country and the history of the profession. When founded as the Nurses Associated Alumni of the United States and Canada in 1896, nurses were working without a system of accreditation or licensure. Becoming an organization unified us and gave nurses a voice to represent and advance the profession. Early on, ANA showed the country that nurses were indispensable in national emergencies. 2 years into the organization's founding, the Spanish-American War broke out. ANA members acted quickly in 1898 to establish the Army Nursing Corps. This was followed by even more demands on nurses during World War I. Nurses were relied upon to educate patients about hygiene and disease prevention. And when the Spanish flu of 1918 blindsided the country, there were only slightly more than 66,000 registered nurses in the US and over 17,000 who weren't registered. Again and again, nurses have been faced with extraordinary circumstances and then demonstrated their skill and fortitude. Efficiency, service, humility was our motto when the organization changed its name to the American Nurses Association in 1911. With clarified identity and recognition, nurses began fighting for their rights, and in 1934, members lobbied for an 8-hour workday. Protecting the interest of nurses and patients has been foundational to the ANA legacy. Through our activity, policymakers began to recognize the essential role nurses play in healthcare. In 1940, we established the National Nursing Council for War Services. By 1943, 36,000 nurses were serving in World War II. ANA was also the first association of healthcare professionals to endorse the creation of Medicare in 1965. Over the years, we've launched various campaigns for healthcare reform, fair pay, and free immunizations for uninsured children. In 2010, we rallied nurses to assist Haiti's earthquake victims. Last year, our president, Dr. Grant, reminded nurses of our code of ethics that obligates us to advocate for human rights and the health needs of children. Previously, the 2018 ANA Membership Assembly endorsed a statement opposing the administration's policy and practices that forced family separations. As nurses, we called for more compassionate, humane immigration policies. Historically, ANA has fought to break barriers for minority groups, women, and underserved communities, but there is much more to be done, and this advocacy continues to be a top priority. Our presence in Washington and with state legislatures gained a stronger foothold during the pandemic. ANA advocated with White House officials and Congress about the dangerously inadequate supply of personal protective equipment for healthcare providers. Testifying before Congress, our advocates explained the limited life of an N95 mask and why they were so imperative for those on the front line. We gathered data on the number of nurses who had contracted COVID-19, as well as those who died from the virus. Our testimonials garnered attention, and more importantly, our efforts led to getting PPE to more nurses. And while supplies have greatly improved, our advocacy continues in an effort to get nurses what they need now and in the future by demanding an improved supply chain. ANA also led calls to action for testing and treatment of healthcare professionals exposed to the coronavirus. We called on the administration and Congress to provide emergency funding for strategies to contain the pandemic, expedite vaccine administration, pass stimulus bills, and urge the Department of Health and Human Services to address COVID-related healthcare disparities. The American Nurses Foundation surveyed more than 120,000 nurses about their experiences for the Pulse on the Nation's Nurses COVID-19 survey series. Those responses were crucial in helping ANA and the foundation understand the pandemic's impact on the country's registered nurses so we could plan and advocate more effectively on their behalf. We also worked to assist our credentialing customers when the American Nurses Credentialing Center's programs quickly pivoted to allow the flexibility needed to meet the needs of nursing and healthcare organizations identified throughout the pandemic. We told our certified nurses and credentialed organizations, focus on what's most important, caring for your staff and your patients. We are here to assist you in doing so. We strengthened our voice and representation by building partnerships. All these activities reflect the ANA Enterprise's responsiveness to nurses and to the well-being of Americans, aligned with our legacy of service. Today, our issues-focused advocacy is hitting the mark across the political spectrum. ANA is working with the Biden administration and Congress on strategies to provide every American universal access to healthcare. And we continue to lobby on issues our members care about, such as elimination of mandatory overtime, payment models that reflect the value of nursing, and leading coalition efforts on APRN scope of practice issues. Another legislative priority for ANA is making the healthcare work environment safer. As many as 1 in 4 nurses is assaulted at work, and that number may be much higher due to underreporting. We are pleased to report that in April, a bill passed in the House that requires hospitals to have violence prevention plans in place. This includes taking steps to reduce the risk of on-site assaults and employ best practices to encourage reporting and employee engagement in prevention. The bill, endorsed by ANA, is moving to the Senate for consideration. ANA keeps expanding its outreach to Capitol Hill. Last week, we held our annual Hill Day with more than 300 nurses and nearly 325 virtual congressional meetings from all 50 states, with even more meetings occurring this week. Our participants lobbied lawmakers on personal protective equipment to be manufactured in America, telehealth expansion, and workplace violence. As in years past, ANA also launched a central call to action in tandem to its Hill Day for advocates to rally behind. This year, it was the PPE in America Act that saw over 2,500 advocates tell their story and over 6,000 emails sent to Congress. Now we're seeing Congress and federal agencies approaching ANA for information and feedback before healthcare policy decisions are made. We look to your suggestions on how we can further leverage this trust. If you'd like to become more involved, join us for a one-day virtual event on September 14th entitled ANA Policy, Innovation, and Advocacy Forum, Empowering Nurses to Lead. One of the first things I did after becoming a nurse was to join ANA. This powerful organization has been an overarching influence throughout my career. My involvement increased over the years as I realized how much I could contribute, as well as how much I was getting back. Through ANA and its exceptional programs, I grew, matured, developed new skills, and made invaluable professional connections. Our commitment to advance the profession of nursing continues to be a priority. I encourage you to visit the new Advanced Practice Initiatives website that ANA launched in May. This new website is the go-to source for information from ANA and ANCC specific to advanced practice. Whether you're a current APRN, student, or faculty member, we're here to support you along your journey. Today, I'm honored to give back to the profession as an ANA leader. Most important to me is the feeling of connectedness I find with other nurses who belong to this organization. People like me who entered nursing because they wanted to make a difference. The experience of putting on my lab coat again and vaccinating people against COVID-19 that first day reminded me of why I became a nurse. The people I vaccinated were exuberant about defeating this virus. And after a busy 8 hours, I came home tired and very satisfied. My work felt as meaningful and important that day as when I was a young nurse giving measles injections many years ago. There's a quote from the 1897 meeting minutes that outline the original goals for the organization, goals that are relevant today. To establish and maintain a code of ethics, to elevate the standards of nursing education, to promote the usefulness and honor the financial and other interests of nursing. We can take pride in how ANA is still relevant and contributing to the public health of the nation 125 years later, and how after only 30 years, ANCC has made such an impact on nursing excellence. That's what you call a legacy. Thank you for your part in making nursing and this organization such a vital, positive force in the world. And after 41 years, I can still say it's great to be a nurse. Thank you so much.